I'm filming.
Okay. I'm going to center for 30 seconds. Okay. Hi, Mr. Johnson. My name is Nicole, and I'm a student nurse, and I'm going to be giving you some medications today. How are you feeling?
Good.
I understand you're in some pain. Can you rate your pain on a scale of 1 to 10 for me, please?
6.
6, okay. Well, I have some morphine for you, and hopefully that will help with your pain, and I also have an antibiotic for your pneumonia. So I'm going to go and get those started for you. Okay, so I have my MAR and my orders. I'm going to start just with doing my second check while preparing my medication. So I'm going to grab a couple flushes. And then I'm looking for morphine sulfate. And Triaxin, alcohol, syringe, needle. Okay, so I am going to start by doing 7 rights for my second medication check. So my patient is Earl Johnson, no known drug allergies, date of birth is 12/12/1938. I am giving him morphine sulfate. This says it's 2 mg per mil, and he is dosed at 2 mg, so I'm going to give him 1 mil. It's due right now, and every 3 hours is needed for pain, and he rated his pain at a 6 out of 10. So it is indicated, and let's see, it's not expired, and he's not allergic to it. Patient, med, dose, route, time. It's IV. I think I got that all. Okay, so that's my morphine sulfate. I'm going to get that prepped. So first I'm going to take the lid off the vial. There we go. And then I'm going to swab the top with an alcohol pad for 15 to 30 seconds. So I would do that for that amount of time. And then I'm going to pull 2 mils of air into this syringe, or no, 1 mil. So I'm doing 2 mgs in 1 mil. So I'm doing 1 mil. Okay. So I'm going to push the air in. Make sure the tip is in the liquid and pull out 1 mil. And then at this time, if I needed to waste any of this medication, since it's a controlled substance, I would grab my nurse leader or a coworker to be a witness to that. Okay, pull that out and then scoop. Okay, and it's possible that I would need to dilute this. I don't believe I need to right now, but if I did, I would follow that and grab a flush and make sure I had a certain amount of saline in here, and then I would put the medication in there and use this to administer. And I would want to make sure that the morphine is compatible with the IV fluid. I know that it is, and so if it wasn't, I would want to do a flush before and after, but because it is, I'm just going to do a flush after, because he is on a continuous. Okay, so now I'm going to label. Okay, let's see, this is for the IV tubing, this is for the label. Okay, So, Earl Johnson, date of birth is 12/12/38. No known drug allergies. I am giving him morphine, 2 mgs, and it expires June of 25. Okay. Put that around the label. And then I would want to prepare my second medication. So that's ready. So the second medication is ceftriaxone. So this is an antibiotic. It's an IV pushback or IV piggyback. So the patient is Earl Johnson, 12/12/1938. The med is ceftriaxone. 1 gram that's suspended in 50 mils. And this is 1 gram suspended in 50 mils. It's IV. It's due right now and every 24 hours. I'm supposed to administer it over 30 minutes. So it's 50 mils, so I'll make sure that I set the infusion rate at 100 mils per hour. I'm giving it to him because he has pneumonia, and I'll make sure to document once I've administered it. So in order to get this ready, I have my secondary line. Okay, so I would make sure to just do more hand hygiene. Okay. So I did my 7 rights. I also want to check for the integrity of the bag. So I see that it's not discolored. There don't appear to be any leaks or tears, so that's good. So I want to move forward and prime this. And I will get my label ready as well that I will put on the tubing. So my initials and the start time, which is going to be today at about, I think it's, what time it is?
10:25.
Awesome, thank you, 10:25. Okay, and it is ceftriaxone. Okay. I'm gonna put this around the tubing before I forget. Okay, so now I am gonna go over here and hang my secondary. Okay, that works. And now I'm gonna prime my secondary. So in order to do that, first I want to make sure to clamp this before doing anything. So that is clamped, and now I'm going to spike the bag.
It's a twist off.
Okay. So I'm going, part of priming it is filling this chamber halfway. Great. And then I'm going to slowly unclamp this and try to not waste any medication as much as possible. So I'm going to watch it go down. Okay, there it is. Okie dokie. So, the to give my medications. Okay, so Mr. Johnson, I am getting ready to give you your medications. Can you confirm your name and date of birth for me again?
Earl Johnson, 12/12 something for the year.
Great. I'm gonna grab some gloves. All right, and are you having any pain on your IV site?
No.
No? Okay. I'm just gonna check it to see if there's any signs of infiltration.
You're pretending it's going into the AC.
Oh, okay. Okay, here we go. Okay, and can you give me your name and date of birth one more time?
Earl Johnson, 12/12 something year.
1938. Great. Okay, and so that matches my MAR as well as his armband. Earl Johnson, 12/12/1938. Okie dokes. So I am gonna go ahead and give the IV push first. So I want to make sure I have my medication, I have my MAR, have some alcohol swabs. Okay, so I'm just going to do one more check before I give these to you. So Earl Johnson, this is the morphine. Morphine 2 mgs, IV, due now and every 3 hours is needed. For pain, he's not allergic to it, it's not expired. He rated his pain 6 out of 10, so it's due. And yes, okay, so for administering this medication, what I am going to do is grab the port. I want to clean this. Want to make sure I clean this for 30 seconds, rubbing it vigorously. And then I want to, looks like I'm going to use the needle. Okay. Put that in, and then I would want to stop the infusion. Pause. Alrighty. And have you had morphine before?
Yes.
Yes, okay. So just so you know, if you get a little dizzy, I'm experiencing resistance. So when that happens, it means that it could be an occlusion. So I just want to double check what's going on. I'm not sure. So
You have a minute left.
okay, so I'm not sure, and so I would, in that instance, I would need to check for an occlusion or what's going on, to check that I would see if there was any visible blood in the line. So usually, if that was not occluded, I would want to administer the morphine over 5 minutes and then flush with one of my flushes after that. And then I would continue. And then next for the piggyback, what I would want to do is make sure I have an alcohol swab. I would do my third check, checking the right patient, Earl Johnson, ceftriaxone, 1 mg IV. It's due right now and every 24 hours. So I want to make sure this is clamped. So I'd rub that for 30 seconds, and then I would find the most distal line. I'm going to pause this. I would put this in, and then I would hang the primary line lower than the secondary. this guy. And let's see. And then if I were to start it, I would want to make sure that that was dripping and not that. Okay, Mr. Johnson, so we got that started. I will be back in 30 minutes to see how that morphine has kicked in, and as well as to see if the antibiotic has fully gone. I would set that to 100 mils an hour, 50 mils is the volume to be infused. And then always hand hygiene, and then I would want to document on the MAR with my initials. And yeah, I think I'm out of time.